Welcome to the Insurance Producers Guild, delivering intelligence for independent agents to help you stay ahead of the trends shaping Medicare, ACA, life insurance, and the broader insurance market landscape. Let's get started.
Welcome to the deep dive. Today, we are unpacking the finalized 2026 Medicare Advantage and Part D changes.
Yeah, there's a lot to get through today.
There really is. We are looking at a pretty hefty stack of sources here. We've got the official CMS press releases and fact sheets, plus a really great snapshot analysis from KFF, the Kaiser Family Foundation.
Right, which is always incredibly helpful for context.
Exactly. And our mission today is to take these wonky, high-level policy updates and translate them into what is actually happening on the ground. We are talking healthcare market stability, plan premiums, and shifting benefits.
And, whether you are analyzing the healthcare market, working in the industry, or honestly just trying to understand how these massive government programs are adapting, this is your shortcut. This is how you become the smartest person in the room about the 2026 landscape.
Let's start right there with the underlying mechanics, the financial picture. Because looking at the CMS rate announcement, the top line average payment increase from the government to Medicare Advantage plans is set at 5.06% for 2026. But the figure that really stands out, the one that caught my eye, is the 9.04% effective growth rate.
It's a huge jump.
It really is. How did CMS land on a growth rate that much higher than what they initially projected?
Well, it basically comes down to the lag in data reporting and late-year utilization spikes. CMS had to recalibrate that effective growth rate based on updated fee-for-service expenditure data that came through late 2024.
So people were using their benefits more than expected.
Exactly. They saw higher than expected utilization in the traditional Medicare population late in the year. And because MA benchmarks are tied to fee-for-service spending, that 9.04% is a direct reflection of those rising systemic costs.
That makes total sense. And on top of that baseline growth, CMS is finalizing the phase-ins for the medical education cost adjustments, right alongside the full integration of the updated MA risk adjustment models.
Yep, those are all locking into place.
So with all these payment models shifting and systemic costs clearly rising, my immediate assumption would be that consumer premiums are going to absorb some of that impact.
You would think so.
Yeah.
But the big question is always, what does this mean for the consumer? For you? And the KFF data shows something completely different.
Really?
Yeah, it reveals remarkable stability on the consumer side. In 2026, 67% of Medicare Advantage prescription drug plans with MAPDs, they will charge absolutely no additional premium beyond the standard Part B premium.
Wow.
And that is the exact same percentage we saw in 2025.
So basically, 2/3 of the plans are absorbing the shifting back-end costs without passing a monthly premium increase to the enrollee.
Correct. And from an access standpoint, a whopping 98% of all Medicare beneficiaries have access to at least one zero premium plan in their local market.
98%. That's essentially everyone.
Pretty much. When you aggregate the entire landscape, the estimated average monthly premium across all enrollees is sitting at just $14.
Okay, here's where it gets really interesting to me. If payments from the government are shifting, but premiums are holding steady at basically zero for most people, the trade-off has to be happening somewhere else. The math has to balance.
All right, the margins are being squeezed, and the KFF snapshot shows us exactly where it's in the extras. The supplemental benefits are taking the hit.
The perks.
Exactly. We are seeing a distinct contraction in those periphery benefits. A smaller share of plans will offer them in 2026. We're talking about reductions in over-the-counter allowances, meals, and transportation benefits.
So the things that used to be splashed all over the television commercials to get people to sign up.
Right. For the past few years, those extras were the primary levers plans used to market themselves. Now, to protect that $0 premium core, they're trimming those exact same benefits.
It is a noticeable shift in strategy, but it's not just the plans doing this voluntarily. CMS is actively stepping in with some heavy guardrails.
Yes, they are.
Looking at the CMS fact sheet, they are codifying strict rules around the special supplemental benefits for the chronically ill, the SSBCI. They're actually rolling out a definitive list of non-allowable items,
which signals a massive market reshuffling. By publishing that hard list of what is not allowed, CMS is drawing a very clear line between what counts as an actual healthcare benefit versus just a lifestyle perk.
Which significantly alters how plans operate. They are tightening the reins.
Exactly. It's a correction.
So shifting from benefit design to actual operations, the CMS rules also mandate several back-end changes that are going to heavily impact doctors and pharmacies. Let's look at the hospital side first.
Okay.
MA plans are now restricted from reopening or modifying approved inpatient hospital admissions unless there's obvious error or fraud.
And that is a huge deal for hospitals. It gives them so much more certainty.
Right. No more retroactive denials on something that was already approved.
Exactly. It forces payers to do their clinical reviews precisely on the front end.
Yeah.
Once that inpatient admission is approved, the plan basically cannot walk it back.
And there is an equally aggressive operational timeline being enforced on the pharmacy side with Part D. The rule dictates that initial prescription drug event submissions, the PDEs, must occur within 30 days of claim receipt.
Right.
And for certain selected drugs, that window shrinks to just 7 days.
7 days is an incredibly tight turnaround. A prescription drug event isn't just a simple receipt, it's a complex data record.
Right.
By shrinking that lag time to 7 days, CMS is giving itself the ability to monitor Part D cash flow and program integrity almost instantaneously.
They want immediate visibility into those high-cost therapeutics.
Absolutely.
Which makes the items CMS chose to leave out of the final rule just as revealing. Because looking at the not finalized list, 2 major policy proposals were essentially put on ice for 2026.
What's fascinating here is what they explicitly chose to skip. First, the AI guardrail.
The ones related to utilization management equity analysis.
Yes, they paused those requirements.
And the second major item left on the not finalized list is Part D coverage for anti-obesity medications.
Right. Adding coverage for those weight loss medications would fundamentally alter the actuarial math of Part D. These therapeutics have massive consumer demand and a very high price point.
So they are essentially waiting for the market to stabilize before absorbing that massive financial liability into the Medicare program.
The calculated delay, yes.
So just to quickly summarize this for you listening, 2026 is bringing steady premiums and payment bumps, but it comes at the cost of some of those flashy supplemental benefits alongside much tighter rules for plan operations behind the scenes.
That's the landscape in a nutshell. And I would just leave you with a final thought to mull over regarding those unfinalized policies we just talked about.
The AI and the weight loss drugs?
Right. Think about the massive rising consumer demand for those weight loss medications. And look at the explosive growth of AI in healthcare decisions.
It's everywhere.
It is. So if CMS is hitting the pause button on regulating AI and covering anti-obesity drugs for 2026, how will the sheer market pressure of these 2 defining trends force the hands of policymakers in the years immediately following?
They can't hit pause forever.
No. The pressure is only going to build. The market is moving too fast.
It is going to be incredibly fascinating to watch how that plays out. Well, thank you so much for joining us on this deep dive today. We hope this breakdown gives you a clearer, more actionable understanding of the shifting Medicare landscape. Until next time, keep questioning the world around you.